Welcome to Taiwan Talk on ICRT. I'm Ryan Drillsma. Today I speak to Professor Chang-quan Chan of the National Taiwan University's College of Public Health about the new normal, or life after COVID-19. Professor Zhan has advised the government on pandemic prevention and has some interesting insight into what a post-COVID world might look like. How are you today?
I'm fine, yeah.
Good. So the first thing I wanted to ask you is about your vast amount of research on public health. Can you talk about the research you've undertaken on COVID-19 in particular?
Yeah, from the beginning, I have been involved in tracking the development of pandemic in Taiwan in the world, and in Taiwan in specific. We have been doing a lot of research on non-pharmaceutical interventions for COVID-19, which means mask wearing, social distancing, and delay of this mass gathering, and prevention of pandemic in Taiwan. And I personally give a lot of personal advice to our governments right from the beginning of the pandemic, especially for border control. That's very critical to the success of Taiwan's control pandemic.
Can you talk about some of the research papers that you've published?
Yeah, we have a couple of papers. One is so-called Taiwan model of COVID control. We lay out in April 2020, mentioning that why Taiwan learned the hard lessons from SARS. Then later on, we arguing that universal mask wearing would be a very right decision to do, even though in the beginning Taiwan are short of masks, and we're following the same advice from US CDC or WHO, say that only medical personnel or people who are sick needs to wear masks. But personally, I have strong opinions on that time. Right in March, I think universal mask wearing would be important.
I believe you've also written about digital tracing.
We are one of the first country to do that by integrate the travel history with our national insurance card. That we can inform the physicians in clinics to the medical centers that the patient you're seeing could have some travel history. That time could be a potential threat of carrying virus to the hospital or to the clinics. So this makes this hospital infection control more easily, because you are kind of fending off this potential carriers from a very important healthcare facilities.
Speaking of digital infrastructure, a lot of other countries like the UK and in Europe have track and trace systems in place. Why do you think these places haven't been as successful as Taiwan in containing the virus using these techniques?
I think the techniques in some countries are there, especially in UK. They do have NHS systems, and it would be very easy for them to involve. But this is privacy versus public health control. As in a democratic society, we need to take a very fine lines of doing this. But it's a matter of decision at a very critical time that you have to resort to more extreme measures at that time. But you cannot do it repeatedly. Once the pandemic has been slowed down, you have to respect the privacy. But at Taiwan, that time, when you don't have vaccines and you have a lot of unknowns, I think the government made the right decisions, and the society at that time respect this kind of decision. But until now, I think if we know more and more this virus, and we know how they are transmitted, and the need for digital tracing should be balanced with this privacy protections. Yeah.
Why do you think the Taiwanese public are or have been so accepting of these digital tracking measures compared to people in other places? Do you think it's the experience with SARS that has led people to think, oh, I'm willing to give up some of my privacy so that I'm protected from this pandemic?
I think so, because during the SARS pandemic in Taiwan, that's people are moving from one hospital to another hospital with the SARS virus, and that killed physicians and nurses, and the whole hospital has been shut down. I think that scared people, that physicians and nurses that are supposed to cure the patients, and the hospital should be the place for recovery, right? Now that scales. I think the hard lessons we learned back in 2003 is very important, and I will believe a lot of countries after this pandemic, the hard lessons they are learning now will be very useful and very fruitful for future preventions, and let us to be more resilient to future pandemic.
Okay. Let's move on to our main topic of conversation for today, which is the new normal. Now, we've all been wearing masks on public transport and in crowded places for over a year now. Everybody's frequently sanitizing their hands. Do you think these things will become normal fixtures in everyday life? Will we ever stop wearing masks on public transport in Taiwan?
Yeah, for post-COVID-19 new normal society, that is a process. So it's not a switch on and off. You will see a process of moving to a new status of daily life.
What will this new daily life look like?
If we are mixtures in the public, the best way is still wearing mask until the herd immunity appear. That means our protections outweigh the risks. And people talk about in a society from 70 to 80% of population has been vaccinated. At that time, we don't need social distancing and we don't need this mask wearing. But to what extent? Because people's behavior has been changed.
Do you think people will become reluctant to join large social gatherings like arts and sports events or go to movie theaters once the pandemic subsides?
We'll have second thought. They will take their own risk into considerations, and it also depends what the trust they have and this government's measures. So the trust and the transparency that the government need to provide.
Do you think people will take more care of their personal health when they're outside and attending such events like these? For example, sanitizing their hands or maybe wearing masks regardless of whether the pandemic is over or not?
Yeah. As I mentioned, the universal mask wearing, I use these examples of authority that Taiwan influenced the whole world in every household in Taiwan before pandemic. We have some stocks of masks already. So this kind of thing will influence the whole world.
Do you think everyone will continue to wear masks even after the pandemic?
Every household after the pandemic, they will have probably one pack of mask ready for use. On the normal daily life days, in Taiwan, in transportations, you see people wearing masks. So still, we'll have a proportion of population will continue to wear a mask in public transit. This is kind of new normal we'll see, and I can see more acceptance of wearing masks in many Western countries, which culturally are very resistant to that, but at least in the future they will be more acceptable for people who are wearing masks in airplanes, in subways.
While you've mentioned aeroplanes, I want to go back to something you talked about before, which is global travel. Now, you said after travel bubbles are established, these will become travel webs once more and more countries achieve herd immunity. Do you ever think global travel will resume how it was before the pandemic? Will there be more checks at airports or anything like that?
Well, yeah, everybody's looking at the United States. Think about 911. They changed all of the security check in all the airports. And in the United States, there will be a lot of travels, and there will be a guideline come out. Do you need an immunity certificate or passports to book your ticket or pass the security? We'll see. Then after your entry, do you need quarantine or not? And where should be quarantined? That will be another thing that will affect the travels.
My final question is not necessarily about public health, but more of your opinion on social behaviors. People have now gotten used to hosting events, meetings, working from home online. Do you think this is just going to be a temporary shift in people's behavior, or do you think even after the pandemic, this will change the way we live and work for a long time?
Yeah. In the past, it's no matter what the business you are, academic, industries or service industries, there's always this kind of symposiums and a big gathering of event, show. All this will get people together in person, right? It's kind of a big trend. But after this, it will be changed. For certain conferences, we will see more and more online or hybrid. I think that would be very good in the future, especially for low-income countries. It's been painful for academics from less developed countries to attend a high-price conference in developed countries, and we will accommodate this to reach the point of knowledge sharing and experience sharing, all these kind of things.
What about other kinds of events like religious ceremonies?
For some kind of events, you can never replace it, right? That's more like religions, cultures, that's have 1,000 years traditions that's hard to change, but the scale, the format can be changed, and we are seeing that. And business travels will be largely changed, right? Because after this 1 and 2 years experience, a lot of companies find out you don't need to spend so much traveling expense to get the same economic result you want. So that will be affects our hospitality industry.
Just one final question. Is there a possibility of another pandemic like COVID-19 happening in the near future?
Yeah, the answer is yes. Yeah, definitely. Yeah, there's still a lot of unknown sources of our known virus, bacteria, or emergence new versions of virus coming out. That's it's a matter of time, and we have to be always ready for that.
Thank you, Professor, for joining us on Taiwan Talk today.
Yeah, thank you very much.
Hi, I'm Ryan Drillsma.
And I'm Trevor Tortomasi.
And we're the co-hosts of Taiwan Talk.
You can catch our show on ICRT every Monday during the 8 a.m. and 7 p.m. newscasts.
Or you can catch us on Apple Podcasts, SoundOn, or wherever you might usually find podcasts.
New episodes are uploaded every Monday night.
Thanks for tuning in, and we'll be back next week with a new guest.